Thank you for having me. I'm Jos Bell. I'm the chair of the London Socialist, the London branch of the Socialist Health Association, which is the Labour Party affiliate health socialist society. I've been following this particular story with great interest for various reasons. I used to live in this area, and also simply from my role, and also an awareness of what's happening to the National Health Service nationally. I also go attend the consultation events that the London Ambulance Service have been holding.
Can we get to the question, sorry?
Yes, that is my question, basically, is how are you building a relationship with the London Ambulance Service? That I did put to Anne Dinsmore before she resigned, scenario as to what the circumstances were with spikes since Hammersmith and Central Middlesex had closed down. And she said, yes, there were very definitive spikes at Norfolk Park and Hillingdon alternately. Now, with plans to downsize further, what are your plans for liaising with the London Ambulance Service to also relieve the pressure on their service, because they're really not in a good place? So that's my question.
Thank you.
Thank you.
Thanks for that, Jos. We work very closely with the London Ambulance Service. As you can imagine, we've got some big A&E departments, we've got a major trauma service, so we need to have a very close working relationship with them. And as you say, when they have pressures in their demand, then it's the hospital system that experiences those as well. I suppose one of the areas that we have particularly focused on with them is our offloading times, which is the time from them arriving at our front door to us receiving that patient and becoming the carer for that patient. And we've generally got extremely good offloading times, and that's critical because that means that those ambulances get back on the road more quickly. So I think part of your question is around how we as a sector as well work with the ambulance system to ensure that there is a more smoothing of demand at each of the hospitals across the North West London sector. And there are daily meetings around that to try and ensure that we are working together as a system, so not just the hospitals working together, but with the ambulance service to try and smooth those patterns of demand and how we receive and offload their patients.
I just comment there briefly. What you've just said now doesn't actually reflect the conversation that was had, or the Q&A that was had at the London Ambulance Service, and we know Anne subsequently resigned because of pressures across London. But the taking out of services in your area, but as in A&Es, has clearly created additional pressures on the ambulance service, and we've heard of ambulances queuing with patients for several hours, and you just said generally very good. That's a bit of an amorphous statement, frankly. So I think we'd probably quite like to see some more specific statistics on that. I would. Yeah.
We'd be very happy to share the data on our offloading, because as a trust we're actually a very good performer in that area.
Okay.
So I can't comment on other hospitals across London, but obviously I can comment on our hospitals, and we do perform well, but we'd be very happy to share that data with this group.
And also to get the data from Norfolk Park and Hillingdon, because it's all of a piece, I think.
Well,
if we can do that.
But again, Imperial can only give us the data at the latest time. Thank you very much.
You can compare. Okay.
So there's another lady who wants to ask a question. Do you want to come up to the microphone as well, please?